Good afternoon, everyone. It's a great pleasure to be here. And I'd like to firstly acknowledge that I'm giving this presentation on behalf of Fiona Eldridge, who is one of our specialist therapists within our wheelchair services. Fiona successfully submitted the presentation to the APF panel earlier on in the year, but unfortunately isn't able to be here. In the next 15 minutes, I'm going to go through the challenges that in the UK of accessing a powered wheelchair for people with ALS-MND. Really difficult to get the right wheelchair at the right time to suit the needs right then. I will explain the basis of our project that focus on anticipating future needs, and this project has been acknowledged as good practice by statutory commissioning bodies in England, and I'm really delighted to note that we've already had reference to anticipating needs of people with MND, and Jennifer Armstrong earlier on referenced thinking about getting NIV in early, so anticipating future need is crucial. Of course, that means there's always a great deal to do, so we're not sitting on our laurels at all. Getting a wheelchair in England is a very confusing process, even for those people who are working within wheelchair services. Everyone is entitled to an assessment through the statutory bodies. However, many people are unaware of this. Even local wheelchair services have different eligibility criteria, usually based on their ability to fund wheelchairs, which means there's a complete mixed picture right across England, Wales and Northern Ireland. Due to the lack of information, this means there's a mixture of funding streams. Sometimes the statutory bodies will fully fund a wheelchair. Sometimes, due to eligibility criteria, there's shared funding. So the Motor Neurone Disease Association may support with top-up funding for riser functions, attendant controls, power packs, and sometimes when things are very slow, we would fully fund a wheelchair because people just don't have the time to wait. And sometimes people with ALS-MND, due to lack of information, will go straight to a private provider and they will purchase a chair independently, and that can be a very costly mistake. Since 2007, the MND Association has funded a specialist wheelchair and postural management therapist based in one of our in the Oxford MND Care and Research Centre. The expertise that therapist has gained, plus some collaboration with wheelchair services right across the country, has meant that there's a great deal of knowledge being gained, and that has resulted in best practice criteria being developed. It also means that, as the therapist was solely supporting people with ALS-MND, we were able to identify the best features for a powered wheelchair that would support 80% of people with MND and the carers that support their needs. The chair would have the flexibility to be adapted to as the condition progressed, without the need to change the base or the need for multiple assessments. It would always also have the ability to accommodate plug-and-play AAC and EC features. On the basis of this knowledge, we submitted a business case to the Department of Health and were delighted to be awarded a grant for just over £560,000 in 2013. So we have a 3-year project, and the 3-year project is built on a wheelchair pathway, which I'll talk about shortly. And the project had 3 clear objectives. Firstly, we wanted to expand the site, the Oxford site, to 2 other areas across the country, so that we'd have specialist expertise in 2 other locations. We also wanted to develop a powered neuro wheelchair in collaboration with 3 main wheelchair manufacturers. And we wanted that wheelchair to suit the needs of most people with ALS-MND, and for the prescription for that wheelchair to be featured on the websites of each of those manufacturers, meaning that people who were looking and assessing for wheelchairs, who weren't experts in the field, would have some indication of what they should be thinking about, so to support some clinical reasoning. And the last objective was to integrate better assessments for wheelchairs, communication aids and environmental controls, which seem slightly siloed at the moment in England, Wales and Northern Ireland. I mentioned a few minutes ago about our project being based on a pathway. This is our wheelchair pathway, and it was created in 2010. So Jenny Rolfe at the Oxford MND Care Centre and I created this. It specifically addresses the need for speed and anticipation of future need, so future-proofing any of those wheelchairs that are being prescribed. The pathway has been recently updated, and we would happily email this to anybody, so you've got our emails in your abstract, so do contact us if you are interested. Since the grant was awarded in 2013, we are delighted to say that we have expanded to 3 more sites with a 4th underway. Each of the therapists based in those sites attends the local motor neurone disease care centre clinic, adding value to an already brilliant group of multidisciplinary team players. They are able to bring to some of the conversations, those difficult conversations that you want to sow the seeds of some thinking for the future, to think about mobility needs, and link these back to the person's local wheelchair services. You can see from the geographic distribution, you can't visit everybody who's needing a wheelchair, but what you can do is give some expert opinion and some conversation, and then have some discussions with the local wheelchair services. And one of the key roles to the therapists' day-to-day work is to ensure that they're helping with education and training of other wheelchair therapists or other therapists supporting people with ALS, MND in thinking about the needs of the people who've got a rapidly progressing condition, and to really think about supporting what they need for the future. As I mentioned, the therapist in Oxford has assessed and provided wheelchairs for many people with ALS MND since 2007. She has gained an understanding of the key features needed. However, getting these has been a challenge. Jenny found that the features she needed for a wheelchair were seen in different wheelchairs. She might want the foot plates from one chair, a headrest for another chair, and the base from a different chair and a different manufacturer. And every time she needed one of those features, there was a lead-in time, a delay to getting those features. So the wheelchair might be wanting foot plates from Germany and a headrest from the United States, but by the time the person with MND actually got the wheelchair, the needs had changed, and actually the chair was no longer useful. So what she needed to do was to future-proof the chair. Perhaps super-spec it to make sure you think that it's going to work for the future. In addition, one of the most critical features that Jenny had identified was the need for people with ALS MND to have a tension-adjustable back to their wheelchair. So you'll see from this picture the position of this gentleman in the chair. You can see that his postural muscles have weakened, and that means he's got the classic kyphotic posture for a person with MND. And most wheelchairs were coming with a solid back, not a tension-adjustable back. Working with the 3 manufacturers in collaboration, those features have completely changed. Each of the powered neuro wheelchairs has a tension-adjustable back as standard. The powered neuro wheelchair and the prescription that lies behind it has slashed the lead-in time from weeks, sometimes months, to days in some instances. One manufacturer can get a wheelchair prescribed by one of these, with one of these prescriptions to us in 3 days, and that's from Germany. And it's also configured in a way that supports future needs. Why is an anticipatory approach important? Well, I could talk to you until our cows come home and you won't appreciate that. So let's have it from the horse's mouth, so to speak. This is Claire being interviewed by Fiona Eldridge, who submitted this presentation.
So what we're going to be talking about today is all around anticipatory planning around equipment, especially wheelchairs.
Well, first of all, I got diagnosed quite late with my MND. By the time I got to see a neurologist, it was considerable time after my first symptoms, which we managed to predate to about 2009. So my diagnosis at the beginning of spring of 2014, it was pretty far down the line, and I needed to get busy.
And in what ways have you planned for the future in terms of equipment?
Well, at the very beginning, I was asked, firstly, did I want to stay at home, which I made clear that I did, and everybody said it was going to be totally possible. And then secondly, I was asked what my sort of targets were over the next few months, things I wanted to achieve. Two things I did want to do was get my two daughters married, because they were on the verge of being married, and I wanted to plan 2 weddings.
Yeah.
So that really was get busy, be prepared to be able to party over 48 hours at their weddings.
And how do you feel it's helped to have the right equipment in place? Although you kind of answered that.
I have.
The wedding.
It gave me, if I got the wheelchair before being officially eligible for one, A, I could get used to using it, practice driving it. B, the extended family could see me in it, with little nieces and nephews and all, everybody else who's going to be at the wedding could see it was part of me, and that at the wedding it wouldn't be a big surprise and a big distraction. It was all about the bride's day rather than me pitching up in a wheelchair. So by the time it came to the wedding, a month after receiving the wheelchair, everybody expected to see me in it, and being purple, I could coordinate the wedding outfit to go with it, and it certainly enabled me to make the most of a long weekend at the wedding.
Yeah. And have you found getting the equipment in early has given you a different view towards equipment?
Definitely. I was told at the beginning, you can't fight this disease. There is no understanding of the cause, there's no understanding of the rhyme and reason of how it progresses through each client, patient very differently. But what you can do to empower yourself is to try and preempt disaster, preempt catastrophic choices and decisions, take away the emergency provision of anything, and have a feeling of control, not control in a negative fashion, but choices are made in the right order, in the right time scale. With all the information, I can research things using the internet, and I can feel things are being done properly. I did meet an MND person who had been using a manual wheelchair, who had a ramp put in and a through-floor lift. Months later, he was given an electric wheelchair, and his electric wheelchair can't fit in his lift. So things were done in the wrong order. And I thought, that is not happening here. Having that information about how not to do it was a fantastic incentive for me to get things done in the right order.
Okay. And in terms of quality of life, how do you think having, especially the wheelchair in place before you needed it, how do you think that's improved your quality of life?
Hugely. The wheelchair wasn't just about the 2 weddings. I've been able to do things like go to the Royal Opera House to see my niece perform ballet. I've been able to go to the Hampton Court Flower Show. So I have encouraged other people with MND I've met to consider doing these things earlier than they think they need.
What would you say to people that are fairly newly diagnosed? What would be your message?
Make a choice about what you actually need to do. So, like I had targets. What are you planning to do in the next year, and how can that be achieved?
A big difference for Claire. She achieved what she wanted to achieve. But there are a great many benefits from the powered neuro wheelchair to people with MND, as Claire has highlighted, to wider society. So there's a reduction in carer burden because independence is maintained. Good postural management also makes a big difference around complications and hospital admissions. As I've already mentioned, the prescription form means that therapists are having to do fewer assessments, and there's a possibility to integrate it into other functions. And of course, there's a financial implication. People with MND, ALS can stay in work for longer, if that's at all possible. But of course, each of these powered wheelchairs, when spec'd up, is £500 less than if you retrofitted each of the features I've mentioned. So, what next? We've had international interest in the powered neuro wheelchair. I hope you're all going to prescribe it, but we're having an external evaluation. We think this is marvellous, but we need what we think and what is the actual, completely different things possibly. The powered neuro wheelchair and the pathway are considered very important and have been included in the commissioning paperwork for our local primary caregivers. It actually is the only disease featured in our specialist specification for wheelchairs for our GPs and primary care practitioners. So we're delighted that the work that we've done has been recognised at such a significant level, but we need to make sure that that is then replicated in actual practice. And the next steps for us is to ensure that the model specification is used and that we actually manage to get integration of AAC and EC. I'm mindful of time because my colleague's staring at me, daggers, you know how it goes. But I'm used to that, we share an office. So if you want to find out more, we've got some information in your brochures, but also we've got the Professionals Forum. I would love to see an international dialogue happening about all sorts of things that are going on here. So if you'd like to join up, then please do. That's a great opportunity for all of us to learn from each other and collaborate. And finally, I'd like to thank the 3 manufacturers who've worked with us. So it's Invacare, Ottobock and Sunrise Medical. I'd also like to thank our wheelchair services and the specialist therapists. But I think I should like to specially acknowledge Jenny Rolfe. This is actually her baby. It's something that she's wanted to see for the last goodness knows how many years. And she would have been here today. But unfortunately, she's rather busy looking after her own babies. She had twins 6 weeks ago. So thanks, Jenny.
Thanks, Karen.